In this section, I'd like to discuss some of the benefits of patient education using the video system, along with storage and documentation options, and show you a few case histories where otomicroscopy has been very helpful in my practice. The video output on the Prescott's Omni-10 is outstanding and is included in the price because audiologists have all said it's the way to go, much for the same reason as video otoscopy: patient education and documentation. The camera is located here. I have it coming off the left eye on the microscope, and the video signal can go to a TV monitor like the one that I have here, or to an output storage system such as the MediCapture. The MediCapture allows you to take pictures of the ear canal or make videos of the procedures and stores them on a 2 GB data storage device. There's hand-free foot switches for both pictures or to turn on the video recorder should you want to record an entire session. To transfer files, use the data storage key and upload them to a different computer. The video monitor is an impressive part of the microscope package in terms of patient education and storage of video or picture data. Here is an example of a canal without cerumen. You can see here the right ear of a 30-year-old sales rep who visited me in my office. The high quality of the video system shows the canal and tympanic membrane structures vividly, and the basic technique using a #1 Buck-Otto loop. When magnification is increased, look at the definition. When the canal is this illuminated and this magnified, cerumen management becomes much easier for you as a clinician. The next case is that of a 60-year-old family practice physician that refers many of his patients to me who came in to have some shooter's plugs fabricated. Inspection of the right canal revealed a moderate amount of hard brown cerumen, certainly enough to prevent completing the ear impression. Under the microscope, using a #1 Buck-Otto loop, all of the cerumen was gently removed with the physician watching the video monitor or perhaps supervising me as we cleaned his ear. He was happy and impressed. The next is a case of a 17-year-old female, binaural BTE user whose parents wanted her to get some new ear molds. Here, I want to show you how easy and effective otomicroscopy can be. Upon examination, the left canal revealed soft, light brown cerumen, so much so that it needed to be removed before taking an ear impression on that side. In my opinion, referring the child to an otolaryngologist would have been necessary using a traditional method of cerumen management because this girl was very skittish. But with the microscope, and more importantly, the video system, she was able to observe as her cerumen was removed, comfortable because the process was quite easy for me. It didn't take very long and she was amazed by the amount of cerumen in her ears. The next case is an interesting one and one that many audiologists encounter. Here we have an 88-year-old who's interested in hearing aids, and when you inspect his ear canals, he has ceruminosis on both sides. Quite easily, with the otomicroscope, I'm able to extract the cerumen from the right ear. Here's the left ear. And we don't have a lot of cerumen, but there is some on the superior ridge of the canal. Pulling back on the pinna with my right hand, pushing the tragus with the left part of the instrument, I'm able to get a good view of the ear canal and then remove the cerumen, and making sure that I don't touch the lower parts of the ear canal where it's much more sensitive. But before the evaluation, I was able to completely remove all of the cerumen in this patient's ear. I think the point here is that referring this patient to his physician or to an otolaryngologist could have meant not having a chance to complete the audiologic evaluation and or not completing the hearing aid fitting. As such, I had a patient that was very satisfied that his ears were clear, and yes, he went on to purchase hearing aids. I hope this DVD has been helpful in introducing you to the basic concepts and operation of video otomicroscopy. And if you're like me and have a practice primarily in adult oral rehab and hearing aids and looking for a better and safer method to take care of cerumen problems, then I encourage you to upgrade your level of services to video otomicroscopy. And the instrument company that's dedicated to helping your audiology practice is Prescott's. I'll leave you with a final case of a longtime hearing aid user who came in because of acoustic feedback. I always like to check the ears first when a patient comes in with feedback to rule out cerumen. And in this case, cerumen was the cause. Thank you for taking time to watch this presentation. If you have questions, contact Prescott's or feel free to contact me personally.
Touch you right about there. You doing all right?
Mm-hmm.
Yeah, I think we got it. Okay, along the attic too. I think the rest of this is fine. I just wanted to try to get the big stuff out of there so we keep the feedback under control.
Okay.
Okay.